Hey, Dr. Hirshorn, what do you do differently for thyroid? Hey, my name is Dr. Elliot Hirshorn, and I'm at New Life Health in Greenville, South Carolina. And what we do for the last 10 years that's different for thyroid is that we actually dive deep to figure out what the heck's going on. Oftentimes, in the traditional, what's called standard of care, what's happening is they're running a test called a TSH. They're seeing if it's off. If it is, they'll put you on a medication, and they keep you at a dose until they get you inside the range, 4.5 to 5.0. And once you're there, you're good, right? No, it's not magic like that. You could still feel terrible even if your TSH is in range. Why is that the case? That's the case because no one's addressing the root cause of the problem. So what we do differently is we address the root cause. How do we do that? Well, we do more in-depth testing. First of all, with the thyroid, we're not just doing a TSH and a T4, we're running the whole panel. So that's 10 to 12 markers just for your thyroid. Then we're starting to run tests on all of the peripheral issues that could also contribute to thyroid problems. And we're addressing any of those issues that come up as well. And then when we look at your test results, we're looking at them differently. So we're not just saying, okay, the lab core value is 0.5 to 4.5 and you're inside there, so you're fine. We're narrowing that range down to an optimal or functional range because we want to compare you to the best function, not just okay function, because you want to have the best quality of life, right? And so when we get to the point where we find out all the things that are going on, how do we address them? Our goal is not to pile you up with a bunch of medications. We want to help restore the underlying function of what's going on so we can get renewed quality of life for you. So how do we do that? We first use food as medicine. So, and this is going to be different from person to person. We start with a basic foundation, but maybe we've done some food sensitivity testing and that's going to specifically guide your food plan. The second thing is we need to change some things about your lifestyle. So if you're chronically stressed and you're not doing anything to manage your stress, we need to work on that. And the third is nutraceuticals. So from a nutraceutical standpoint, these are supplements that are specifically formulated to accomplish a goal physiologically to get your body to be healthy. And so those supplements have to be in a high enough dose or to be therapeutic to accomplish their goal. So for example, vitamin D, it's a potent immune regulator. It's very often used in people with thyroid issues because number one, it's way low, and number two, it actually helps to address the root cause, which is an underlying autoimmune problem. And so that vitamin D, the RDA, recommended daily allowance from the FDA, says 400 units. Well, that's the bottom of the barrel, what minimum you need. It's not the toxic dose, so you need to have more vitamin D than the RDA is telling you in order to get your vitamin D up to an optimal level. I've had people come in who have been taking 2 or 3 times the RDA and they still have a low vitamin D, and that's why their immune system is chronically attacking their thyroid. So you want to do something differently if you're going to get a different result, because the old saying is if you do the same thing over and over again expecting a different result, that is insanity. So don't be insane. Give our office a call and we can see if we're a good fit to work together.